UKPM in intensive care. A few thoughts on this change from someone who works in medicine. For folks saying this may just be a precaution, yes, that's true. However, something to keep in mind is that in normal circumstances the ICU has a few specific benefits that can't be offered on the main floor. Special therapies. Ventilation is usually managed in the ICU, so if you suspect a patient may need an emergent intubation, it is better to already have them in the right spot. You can also give special drips, medications that are not given as a one-time infusion but that constantly flow into a patient, so you can change the rate minute by minute to try to respond to how the body is reacting/progressing. These and other special therapies can be helpful for everything from cardiac, renal, neurologic, or pulmonary function. Nursing ratio. On the hospital floor, one nurse may cover 3 to 6 patients depending on the hospital. ICU nurses are highly experienced in dealing with very sick patients and usually cover only 1 to 2 patients because of the level of concentration and activity required for each patient. Data collection. The ICU has tools and technology that facilitates easier data collection on a minute-by-minute basis: heart rhythm, arterial blood pressures, respiratory function, etc., etc. It's easier to keep track on data when a patient is in the ICU. Intensivist physicians. The physicians taking care of patients in the ICU are frequently trained, in the US at least, in both pulmonology and in intensive care. They are able to do many different procedures on their own and have more experience with respiratory failure. Now, what changes the equation here is that this is a head of government. So you can assume that the benefits of things like nursing ratio and intensivist physicians go out the window. He probably already had access to 1:1 nursing care at 10 Downing Street, and in the hospital probably had dedicated attention from an intensive care physician, if not multiple. So if he is being moved to the ICU, it is more likely that this is because his condition is such that the team is anticipating that his probability of needing special therapies has increased enough that they don't want to be caught by surprise outside the ICU. Or that they feel his condition has worsened enough compared to prior that they want closer monitoring on how his body is doing on a short time frame. However, it is entirely possible that he never needs intubation, and this is just the smart move to use increased resources to give themselves that extra bit of edge in anticipating problems before they come. ICU resources are expensive, and normally a patient would never be moved to the ICU unless they clearly had a need for ICU level care. When it's a head of government, you can throw the cost concerns out the window. His death would cost far more money than an ICU bed. Edit * for folks circulating stats on mortality after ICU stay. It is not clear how this will pertain to someone like the PM. For the reasons I outlined above, he already had access to many of the benefits of ICU care when he was outside the ICU. So if he still requires ICU level care, one could argue his prognosis is worse. However, one could also argue that he is likely getting the benefits of ICU level care earlier than a normal patient, so he may have interventions that are able to prevent certain complications from developing. Similarly, a normal patient may not have been transferred to the ICU yet if not for being the PM, so he may be healthier than all the other ICU patients. It's too early to know, the data on this is too terrible, and I would not dwell on the numbers. The takeaway is that this is not a good development, but who knows just how poor without access to better information, both about the PM and about all the other patients who have had COVID-19. You don't hear about heads of governments going into ICUs often. This is fucking serious. Fucking hell, that escalated quickly. Fucking hell, Rop is absolutely shitting it in that interview. I can't remember seeing a British cabinet minister so clearly scared. The Times. Boris Johnson experienced breathing difficulties this afternoon and was given oxygen. When it became clear that he needed to move to intensive care, he told an aide that Dominic Raab should deputise for him. He is still conscious. https://Stephen_Swinford/status/1247248538184159232 s=19. We are witnessing some serious shit. Could be the first PM to die whilst PM since Henry John Temple in 1865, who died due to a severe fever. This feels like an episode of Black Mirror. Actually all of 2020 feels like it. Holy shit. They're going to say it's precautionary right up until his death. Is the UK PM position fucking cursed like the Hogwarts dark arts professor or something? This is not good. What are his chances, realistically? This is crazy. Definitely not what I thought was in store for the UK and Boris Johnson when all we were talking about was Brexit. Let's hope he recovers, and serves as an example of the seriousness of COVID-19. I know this thread is moving at a mile a minute, but did anyone see the interview with Dominic Raab on Sky after the news broke? Ignore what he said and look at the man's eyes, breathing and body language. There's a man who's just been thrown in the deep end and is worried. Well, this ought to drive home the idea it's not just the fucking flu. Christ. Was he put on a ventilator? Kenneth Copeland blew the disease away just the other day. This is all so confusing. This is literally history in the making. The past 5 years of the UK with Brexit, lockdown, and the potential death of a PM in office will be talked about throughout schools in 100 years. Boris, please survive so I can complain about you in the future. All the best. Still being reported as precautionary in case he needs a ventilator, but it really is looking serious now. Foreign Secretary Dominic Raab is now acting PM. Hope you pull through this, Boris. His seems to be a very similar pattern I'm reading in many reports. Incubation period -7 to 10 days of feeling pretty bad feeling a bit better sudden decline and requiring oxygen major decline very fast and intubation, within a couple of hours. There's no confirmation that he has been intubated, so I hope it's not that bad, but I really hope this can turn around for him. Wouldn't wish this virus on anyone. Doctor here, thought I'd expand a little bit on what exactly this means. TBF, I'm an American doctor so I don't know the intricacies of UK ICU, but I imagine they're fairly the same. ICU is, obviously, intensive care. It's where we care for people that either have a very high mortality risk or require closer supervision than what you can get on the general medical floor. Typically there is some reason, low blood pressure, low oxygen, high heart rate, with a corresponding intervention, ventilator, constant drips to support blood pressure, etc. that need to be closely monitored. With Mr. Johnson being in the ICU, that means one or more of the following things is occurring. He has been intubated and is currently being sedated, paralyzed, and hooked up to a ventilator to support his breathing. He has medications running through a central line, in your neck, chest, or groin, providing medication supporting his blood pressure. He is on a constant drip of medications. An example is when your heart rate is very high and you need powerful drugs to control it, that need to be closely monitored. He is on supplemental oxygen through something called a high-flow nasal cannula or a positive pressure mask called BiPAP with a high risk for deterioration. With having coronavirus, the most likely thing is that he is either intubated or is on BiPAP and has a high risk of requiring intubation and ventilator support. You don't typically put people in the ICU that don't need to be there. There is a chance he was put in the ICU just because he will get closer monitoring with better trained nurses, but the optics of that don't really look well and they could very easily reassign an ICU nurse to care for him on the floor without having to make it public that he's in the actual ICU. Edit, TLDR, per request. This is no longer just a small case of the coronavirus. There is a very real chance he could die.